Greeting ladies and gentlemen. My name is Dr. Chanchanok Aramrat. Today I would like to present about our research titled An Appropriate Quit Smoking Program for Thai People during the COVID-19 pandemic. As we all know, smoking is harmful to smokers. It increases the risk of developing various non-communicable diseases such as respiratory tract cancer and cardiovascular diseases. People around smokers may also receive these risks as well. This is usually called second-hand smoker, or sometimes called third-hand smoker. With current situation of COVID-19 pandemic, a growing number of evidence has found that smoking increases the risk of severe illness, hospitalization, and death in infected individuals, making the problem regarding the smoking even more important. Regulations of cigarette and tobaccos are quite problematic. They are not as strict by laws compared to other addictive substances. Many health organizations and health sectors encourage people to stop smoking by providing education regarding the harm from smoking and creating campaigns telling people to quit smoke. As for example, World Health Organization have set World No Tobacco Day on May 21st every year since 1988. As you can see here, these are the slogans promoted by World Health Organization in 2020 and 2021. Now come to the objective of the study. This study aimed to find an appropriate quit smoking program for Thai people during the spread of COVID-19 infection from 2019 to 2021. For our methodology, 15 publications and 5 project presentations by Khon University staffs and students were retrieved, reviewed, and analyzed for smoking problems and quit smoking programs. This study was approved by the Ethics Committee for Human Research at Khon University in Thailand, Institutional Review Board, and Nepal Health Research Council. And here are the results. From our review, we can categorize people into 5 groups as follows: male, female, pregnant women, youth and students, and workers. We also did the in-depth interview with each group of people and summarized 5 most common reasons for their smoking cessation. Here's the common 5 reasons for Thai male. The first is for their health. Second is to avoid disease related to smoking and COVID-19 infection. The third is for their families. The fourth is for their friends. And the fifth is for their workplaces. For the second group, Thai female, the 5 most common reasons for smoking cessation are: the first is for the self-image. The second is for the children and families. The third is for the health. The fourth is for the workplaces. The fifth is to avoid diseases related to smoking and COVID-19 infection. In the third group, pregnant women, the 5 most common reasons are: the first is for the babies. The second is for the self-image. The third is for the families. The fourth is for the friends. The fifth is to avoid diseases related to smoking and COVID-19 infection. For the fourth group, the youth and the students, common reasons are: the first is for the parent and their studies. The second is for the friends. The third is for the health. The fourth is for the societies. And the fifth is to avoid diseases related to smoking and COVID-19 infection. For our last group, the workers, the common reasons are: the first is for the health and employment. The second is for the workplaces. The third is for the employers. The fourth is to avoid diseases related to smoking and COVID-19 infection. The fifth is for their families. Then we synthesize quit smoking programs for each group of people. The programs are very similar throughout all groups, so these are important components of the program. First component is the history taking of bibliography and smoking habits. The second component is to do health education about the danger of smoking. The third component is to motivate patients to quit smoking. The fourth component is to present the example of others who successfully quit smoking. The fifth is to suggest behavioral changes technique and exercises. The sixth component is to appreciate those who are able to quit smoking. Another important component is the follow-up. First is to do follow-up at 1, 2, and 3 months after quit smoking. Then a year to evaluate the results. Then 5 years to evaluate the sustainability of the result. These figures summarize our results. The boxes on the left show important components of the program. The boxes on the right down to the bottom show 5 most common reasons for quit smoking in each group of people. Now to discussion. Our review research found that males smoke more than female. This finding is similar to G's report among Korean men and women who quit smoke. They also found, similarly to our study, that the idea regarding quit smoking is different between men and women. We also found concordantly with other studies that most of the smokers are 15 years old and older. Family and community participation have a big influence to smokers, especially young ones who still obey smoking prohibition by their guardian and other older adults. Other studies also found that complete prohibition of smoking in household was one of the strongest correlations of successful quitting, which supports our finding. From our in-depth interview with women, we found that self-image is one of the important reasons to quit smoke. Any program or policy that emphasizes negative image from smoking might be effective to motivate some group of people to quit smoke. This support by Philippines policy that persuade people to quit smoke for their self-image, as a cigarette may outweigh. This result in many people quit smoking. Conclusion: for a successful quit smoking program during pandemic should include these 3 main factors. Number 1, support from governmental policies. Number 2, health personnel who interest and invest in providing quit smoking program. Number 3, strong family and community support. Lastly, we wish to thank all the participants for their valuable contribution to this study. Thanks Provincial Probation Office, the Department of Probation Office of the Narcotic Control Board, ISAN Substance Abuse Network, and Illicit Drugs Substance Abuse Academic Information Development Network for data support. We wish to thank Faculty of Dentistry and Faculty of Medicine, Khon University for financial support. And we wish to thank Intech Open Limited for publication support. These are our references. Thank you very much for your attention. ขอบคุณครับ